Okay, this is just going to be a quick overview over the different assessment techniques. There are 4 assessment techniques, so inspection, palpation, percussion, and auscultation. So it's important to remember to not rush when you are doing an assessment. As nurses, you need to be able to identify findings that indicate serious problems and distinguish them from normal variants. These are all learned practices and it takes time. It requires direct contact with the patient, so we need to make sure that we utilize universal or pathogen-based precautions. And then this is also typically the order that we assess in, except for bowel sounds or the abdomen assessment. This will be a little bit different. But for the most part, you will inspect, palpate, percuss, and then auscultate. Okay, so inspection. So the purpose of this is to look and assess the physical aspects of the body, posture, appearance, and behavioral carefully. You can use tangential light as well to see this. Some examples of tangential light would be like a pen light or a lamp. It's basically just additional lighting that is placed at an angle in order to see more specific or see better for a more specific assessment, such as skin lesions or jugular vein distension. There is direct and indirect inspection. It's important to have a well-lit room so that you can see well, and then we want to make sure that we're maintaining privacy because we may have to expose certain parts of the body to be able to really inspect them. Direct is when we're carefully observing and inspecting a specific area or a whole individual. Indirect is using specific equipment to improve your visualization of an area. For example, like an ophthalmoscope to inspect the eyes or an otoscope to look in the ears. Inspection can also include what you hear and what you smell. Okay, so what are we inspecting for? So we are looking for symmetry. So on both sides of the body, we're looking for symmetry. We're looking at the location of any abnormalities, size, color, pattern, shape, and odors. So anything that we find abnormal, we want to compare side to side and then note these characteristics as well. Okay, so next we have palpation. So this is to touch or feel for surface characteristics. So there are 2 different types of light versus deep palpation. Typically we use our finger pads to palpate. We can use the dorsal surface of the hand and the ulnar surface or ball of the hand. And so there's different things that we're feeling for with these different types of palpation. So again, if we think that we're going to come into contact with any bodily fluids, we want to wear gloves. But if the patient's dry and their skin is intact, as long as our hands are clean, we've done our hand hygiene, we don't have to wear gloves to do palpation. So when we're using our finger pads, this is for fine discrimination and sensations on the surface areas, such as texture, sharp, consistency, pulses, and crepitus. The dorsal surface of the hand or the back of the hand is used to assess temperature. So I'm sure, growing up you had maybe a parent or grandparent assess your fever and they use the back of their hand. This is because it's most sensitive to assessing temperature changes. The ulnar surface or the ball of the hand, this is used to assess for vibrations, fremitus or vibration of the body, and thrills, which are vibrations over the chest wall. Okay, so light palpation. So this is you're touching and feeling the surface for characteristics. Use your finger pads of your dominant hand to gently press down about 1 centimeter or a half an inch. You can use light circular motions with your hands when you're doing this. Gently lift fingers, then move to the adjacent area. Make sure to palpate the entire area that needs to be assessed. So you want to make sure that you're not missing any parts of the area, because then you could miss some abnormalities. Typically, we are palpating for texture, masses, or tenderness. So if we feel anything abnormal during this, or if the patient notes any tenderness, we want to make note of this. Okay, deep palpation. So same concept, we're just pushing a little bit deeper. So this is assessing more for the location and size of internal organs, masses, and tenderness. You want to perform light prior to deep. So do the light palpation first and then the deep palpation. You want to palpate the area of pain last. So if the patient has reported pain, maybe in their epigastric region, we want to palpate that place last. It can be done with 1 or 2 hands, but typically it's done with 2, as you can see in this picture. You want to gently press down 5 centimeters or about 2 inches. Okay. So if we use both of our hands, this is called like a bimanual exam. And when we do this, we want to place the dominant hand over the non-dominant hand and press down. Okay, percussion is another assessment technique that you will see. This is not done quite as often as the others, but it is still important to know how to do it and when it might be indicated. So when we percuss, we're creating sound waves that vibrate. Different tones are listed depending on the underlying tissue density. There are 3 types: direct, indirect, and indirect fist or blunt percussion. Okay, so direct percussion. This is used to assess the size, consistency, and borders of the body organs and the presence or absence of fluid in body areas. For this, you use 2 fingers directly and lightly tap the area that needs to be assessed. So direct, we are just tapping directly onto the area. A lot of times you might see this when maybe you have a sinus infection or something like that, a head cold. Whenever you go see the doctor, they may kind of tap over your sinuses to see if you have any tenderness there. So that would be an example of direct percussion. Also, if you're trying to hear sounds, this works for other techniques as well when you're listening or feeling. If you close your eyes, that closes off one of your senses and it heightens your other senses. So it can be used to help you assess better if you're having trouble really determining if you're hearing something correctly or feeling something correctly. Okay, so indirect percussion, same purpose as direct percussion, but in this case you would lay your middle finger of your non-dominant hand on the area to be assessed, and then the middle finger is the only finger that should be in contact with the patient's skin while percussing. So then you just tap on top of that middle finger of your hand. Okay, so what are we listening for when we are percussing? So there's going to be different pitches, so high, low, or dull. There's going to be intensity or the tone, the duration, and then the quality of sounds. So some examples of sounds you might hear: timpani, dullness, resonance, hyperresonance, and flatness. So the intensity, soft tones are heard over solid tissue. Moderate tones are heard over fluid-filled areas, and loud tones are heard over air-filled spaces. So again, this is based on the density of the underlying structure. When the density increases, the percussion sounds will become softer or more dull sounding. And we're going to go further into detail on these. Okay, so timpani. So the intensity of this sound is going to be loud. It's going to be high pitched, and it's going to have the quality of like a drum. So it's going to sound drum-like. This is typically heard over the abdominal areas that may be filled with abdominal gas or air-filled structures. So examples: gastric air-filled structures such as intestines. If timpani is heard over the chest, this indicates excessive air and could indicate a collapsed lung. Okay, so dullness. So with the dullness, the intensity is going to be soft or moderate. It's going to have a medium pitch, and then the quality is going to be thud-like. So for examples, when you are percussing over the liver, a full bladder, solid organs, or a mass, it is going to have a dull sound. Also, when fluid or solid tissue remains, replaces air in the lungs, such as pneumonia, you could also percuss dullness there as well. So sometimes in some areas, some of these sounds are normal, but if they're in other areas, they can indicate abnormalities. Okay, so resonance. This has a moderate to loud intensity. The pitch is low and it has a hollow quality. So resonance should be percussed over normal lung, so normal lungs will produce a resonance when they are percussed over. Okay, and then there is hyperresonance. So the intensity of this is very loud, the pitch is low, and the quality is going to be booming. So example of this would be hyperinflated lungs. So this would be abnormal. This is associated with someone who has COPD or chronic obstructive pulmonary disease, or someone who has asthma. Okay, and then flatness, the intensity of this is soft. It's going to have a higher pitch, and the quality is going to be dull. So examples of this would be when you're percussing over muscles, bones, joints, or a solid mass. Okay, and then indirect fist percussion or blunt percussion. This might look a little scary, but it doesn't hurt the patient unless they have an underlying issue. So what we're doing is to assess for organ tenderness. So you can see in this picture how it's done. This is most commonly done to assess for kidney inflammation or CVA tenderness. So what we do in this instance, we would place our non-dominant hand over the area, and then we would use our fist, make a fist with your dominant hand, and using the ulnar surface of your closed fist, use moderate intensity to hit the back of your non-dominant hand. And then you'll ask if the patient, if they experience any discomfort when you do this. So again, typically this is to assess for kidney inflammation. Typically it's pyelonephritis or an infection of the kidney. So CVA stands for costovertebral angle tenderness. So that angle of the vertebral and the vertebral column and the ribs there, right here. I don't know if you can see that. But that's where you would perform this, and it will elicit pain if the patient does have kidney inflammation. Okay, and then lastly, we are going to talk about auscultation. So the purpose is to listen to the cardiovascular, respiratory, gastrointestinal, and peripheral vascular sounds produced by the body. You can do this directly and indirectly. So direct auscultation, this is listening to sounds produced by the body without an amplification device. So an amplification device would be either a stethoscope or like a Doppler. We want to ensure a quiet environment so we can really hear. We're going to listen for about a minute. Typically what can be heard through direct auscultation would be respiratory sounds or GI sounds. So respiratory sounds, if they're heard, like maybe wheezing or stridor, usually that's pretty severe if you can hear it without an amplification device. GI sounds, this would be something like, when you hear your stomach growling or something like that, we can hear that without the use of a stethoscope a lot of times. But again, anything that we hear, we want to further confirm with the stethoscope. Okay, and then indirect auscultation. So this is when we use a stethoscope. Okay, so we're listening to sounds produced by the body with an amplification device. So we're going to expose the area to be auscultated. And we always want to make sure we're putting the stethoscope to the skin in order to accurately auscultate. We can warm the stethoscope with our hands, so just kind of rubbing the end of the stethoscope on your hand just to warm it up so it's not too cold on the patient. And then we are going to firmly place either the diaphragm or the bell of the stethoscope on the area to be assessed. So the diaphragm of the stethoscope is the bigger side of the stethoscope, and it's usually used for higher pitch sounds, and the bell is the smaller part of the stethoscope, is used to hear lower pitch sounds. And then just make sure you listen and concentrate again. You can also use a Doppler device for pulses. If you're having trouble palpating pulses, you can use this to be able to hear the pulse if it's there. And then once you're done assessing the patient with your stethoscope, then you will clean it off with an alcohol swab. Okay, and then lastly, just a little review over the parts of the stethoscope. So you have your earpieces that go into your ears. So they kind of point in one direction, and the way they kind of point should go into your ears towards your nose. It's kind of hard to explain. But when you put them in, they should point towards your nose. That way you're going to be able to hear the best out of them. Okay, and then you have your diaphragm and your bell. Okay. Depending on what you're assessing, you will need to twist this to make sure that you can hear from whichever side you're trying to hear from. Okay, we'll practice this in practicum as well, but you want to make sure you have your earpieces in appropriately, and if you're listening with the diaphragm, you want to make sure the stethoscope is turned to where you will be able to hear through that part. So this is just kind of an overview of your techniques that you'll be using throughout your full health assessment, just to kind of help better understand that. And of course, feel free to reach out if you have any questions.